Respected teachers, doctors, and fellow medical students, Assalamu alaikum. I, Fiza Shafi, Senior Vice President, Federalite Student Research Society from Federal Medical and Dental College, 4th year, welcome you all in the first session of this workshop. To start our event with the name of Almighty, I would like to invite Kawal Zahir from 4th year to recite a few words from the Holy Quran.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم ألم نشرح لك صدرك ووضعنا عنك وزرك الذي أنقض ظهرك ورفعنا لك ذكرك فإن مع العسر يسرا إن مع العسر يسرا فإذا فرغت فانصب وإلى ربك فارغب मैं शुरू करती हूँ अल्लाह के पाक नाम से जो बड़ा मेहरबान और निहायत रहम करने वाला है। क्या हमने तुम्हारा सीना कुशादा न किया और तुमसे तुम्हारा वो बोझ उतार लिया जिसने तुम्हारी पीठ तोड़ी थी, और हमने तुम्हारे लिए तुम्हारा जिक्र बुलंद कर दिया। तो बेशक दुश्वारी के साथ आसानी है, बेशक दुश्वारी के साथ आसानी है। तो जब तुम नमाज से फारिग हो तो दुआ करो और अपने रब ही की तरफ रुग़बत करो। सदक़ल्लाहुल अज़ीम।
Jazakallah. Our guest speaker for today's session needs no introduction. A well-known medical educationist, motivational speaker, ex-principal Quaid-e-Azam Medical College and has been a part of College of Physicians and Surgeons, University of Health Sciences and Nishtar Medical University as Faculty of Medical Education. His qualifications include FCPS, FRCS, FACS, FICLS, MCPS, HPE. He is one of the pioneers of laparoscopic surgery in the region. He has trained more than 50 surgeons formally as a supervisor and thousands more who have worked with him in various capacities during his 4 decades-long professional journey. Being an official mentor of Royal College of Glasgow and an international course director of American College of Surgeons for Advanced Trauma Life Support, he is also on the reviewers panel of various index medical journals. He has more than 25 research publications on his credit, along with a book on surgery entitled The Operative Surgery. Moreover, he's a published poet, short story writer, critic, and a broadcaster. His current areas of effort are teaching and training of soft skills at various national and international fora. Apart from this, he's very active on social media and his team runs a very well-subscribed YouTube channel covering versatile topics and interests. Millions of people are getting benefit from his videos on medical education, FCPS training, parenting, relationships, human well-being, and various other social issues. May I invite Professor Dr. Javed Iqbal to start off with today's session.
Thank you very much, Fiza, for this introduction. Thank you very much. I'm humbled. Can you hear me?
Yes, sir, we can hear you.
All right. And can you see my screen as well?
Sir, we can see you. Your screen is not visible.
Oh, I've just turned it on. Okay, just so. Yeah. Can you see it now, please? Can you see my screen?
Yes, sir.
All right. Okay. So this is the first time that I'm conducting this workshop on net. Workshop by definition is learning by doing something. It is learning by activity. So I don't know to what extent we will be able to generate the activities, but I will try my best that I discuss this boring topic in such a way that we understand a bit of it. So welcome to the workshop. And the name of this workshop is Research Methodology Made Easy for Young Doctors. Research is one topic which has always been considered as French. Many of the senior doctors, uh, they are very good clinicians, they are very good teachers, but somehow we lack in our understanding about research. So we devised this workshop so that we can just discuss the basics about the research, and that's what we're going to try now. Okay, you know about me. There's I can skip this slide, and obviously it is not possible to get your introduction, all of you. I understand that there are 10 people who are the team members, and there are many who are watching it in Pakistan and also in some other countries as well. This picture I have put here just to let you know and let you warn that this workshop can be very boring. So you have to be ready and willing to pass through this tough time. All right. Okay. This picture is not put for political reasons. This picture is put that there was a time when we were cricket champions, we were hockey champions, and there are two champions. Can you see my screen, Bacho? Can you hear me and see me, please? See the screen?
Yes, sir,
Yes,
we can
sir.
hear you.
Okay, okay, fine. So you know there are two champions in this picture, and then this is also world champion. And our country has got wonderful land where we can produce brilliant crops. We produce one of the finest jewels and one of the finest rubies on the world. Our surgical instruments are used all over the world. We have got a wonderful cotton industry. We have got a big desert. We have got a nice seashore. We have got so much scenic beauty around us, a very, very fertilized land, and a lot of tourism potential. But, and above all, we have got human resource. As perhaps you know, the maximum population of this country, around 45% of the population of this country has got young people who are around 18 years of age. So this is a very big strength our country has. And when I say our country, I mean countries of this whole region. But unfortunately, this is the situation. Our institutions somehow fail to grow to the level where they should be. And if you see the poverty level of the country, the picture is very sad. And these are some of the ugly, ugly scenes, some of the ugly scenes. And this is the situation of our economy. So for me, the purpose of this workshop is actually that we may be holding very expensive telephones in our hand, but that is not important. The important thing is whether we are consumers of technology or we are producers of the technology. Those nations who are producers of the technology, they always govern the whole economy, politics, and social management of this whole world. And this is not possible without research. And research, this is why I have designed this workshop, so that we can infuse the culture of research in our undergraduate level, so that when they become doctors and when they become scholars, they are able to carry on with this research potential which they have. So for me, this is the reason for conducting these workshops. Now, what is my expectation? My expectation is that at the end of this workshop, the participants will become change agents of promoting a culture of research in the global perspective. Whenever I was just conducting this workshop with the second year students in Qaid-e-Azam Medical College. There were 20 people sitting over there, and they said, "Sir, global perspective? We are just 20 people, students of a medical college. Why you said global perspective?" See, there was a time when something brilliant used to occur at one place, world may never know it. But nowadays, if you have a brilliant idea, you just put it on internet, and that idea may attract the global attention. See, Uber is an example. Facebook is an example. And there may be brilliant, billions of examples where very young people, they had an idea and they float it in the world, and then they become kind of a leaders in that technology. So my expectation is that at the end of this workshop, at least we can realize that we can be those change agents which can have a global impact. And second expectation is that we are able to develop a team which is promoting the culture of research. Now, this is the vision. And what actually we're going to achieve after this workshop, what is my expectation is, let me tell you that this workshop is actually 4 days workshop, but I have just made it a kind of a summary so that we have a taste of it. And once, inshallah, this corona thing, when it will go away, we can actually plan to have live workshops so that the actual objectives are achieved. So the first objective is, and if we concentrate, I'm very sure that at the end of this workshop, the participants will be able to develop research proposal, and they can conduct the basic research themselves. And secondly, they will be able to supervise their juniors in their research projects. If a project is going on in that department, so the whole team can actually supervise it. So that's what, inshallah, we're going to achieve. I just skip that. Normally what I do is that I just put this picture and ask the whole of the participants to just give their comments that what they get from this picture. But here we don't have such a scenario. So let me tell you that the person who painted it, he named this picture as knowledge, because he thinks that knowledge has got a connection with the divine. Knowledge requires strength. It requires a hard work, like filling an ocean, and it requires energy that you may have to work late night so that you can produce some kind of a vegetation. So this picture was knowledge, and this picture has a lot of relationship with research. Now, before going into actual methodology of research, let me give you a little historical background that from where this research has come. If we follow the history of human consciousness, we know that in initial times, people have a dualistic perspective. Dualistic perspective about knowledge means that people believe in black and white type of thinking about knowledge, which means there is something which is yes, there is something which is no, which means knowledge is fixed. जो है वो है, जो नहीं है वो नहीं है, जो है वो चेंज नहीं हो सकता, जो नहीं है वो भी नहीं चेंज हो सकता. So this was the initial understanding about the truth and about the nature of knowledge. Later on, when human consciousness, I'm talking about, maybe thousands of years. Now, once the human conscious, it developed, the next stage was that from dualistic perspective, it went into relativist perspective. Now, relativist perspective means that there is yes or no, but there is a third dimension as well, which is maybe. Because things are good or bad, or they exist or they don't exist, not in absolute terms, rather they are in relative terms. Now, for example, if we call someone beautiful, this is not an absolute term, because a beautiful is one which has got more beauty, but there may be someone else who may be having even more beauty than that. With reference to that person, will we be calling this person beautiful or ugly? Right? So things are actually in a relative perspective. Okay, can you hear me? Are you with me, all of you, please?
Yes, sir.
Yeah, thank you. Because I'm talking continuously, so I need a little kind of prompting so that I know that all of us are together. So I hope you're understanding what I'm saying, right? Right?
Yes, sir.
Okay. So when human consciousness actually started doubting that whenever an absolute thing is discussed, it may be possible that that is not absolutely true. There may be some other dimensions of that fact as well, because absolute thing in our belief is only Allah subhanahu wa ta'ala. Rest of the knowledge is basically all relative. Now, so having discussed this thing, what is in your opinion should be the definition of knowledge? I told you there was a dualist perspective, and then there was a relativist perspective. Now I will just pause for 10 seconds so that all the viewers, they just think in their mind that what do they think about knowledge, and try to make your own definition. What is knowledge? Can anyone please respond? What has come in their mind? What do you think is knowledge?
Sir, I think knowledge is basically facts and figures, which are either like they have been identified by people or they haven't been identified. That is what is knowledge.
All right, okay. Now see, knowledge is defined as justified true belief. Now let me clarify it further. See, this is the truth. This red circle is the truth which is there in whole universe. And we as a human being just know a little glimpse of it. What is happening in Mars, what is happening in Milky Way, what is happening in depth of the sea, what is happening on deserts, what is happening in human mind, what is happening all over the universe. This is the whole truth. And we, with the help of our genetics and also our preconditioning through our nurture, have a belief system. All of us have a belief system. When I say belief, that does not necessarily mean the religious belief system. Every belief system, for everything we have got a belief. Now this belief and truth overlaps. And when it overlaps, this is what is in our grasp. And knowledge is defined as justified true belief. So in order to call something as a knowledge, first of all, it should be true. Secondly, it has to be part of our belief system, or we have to drag it into our belief system. Because it is quite possible that there are a lot of beliefs we have, but they not be part of our truth. I know if some of you are working in surgical ward, you are medical students, people here in Pakistan, I don't know about India maybe also, because some of our viewers are from India as well. People, they say that if we drink milk, our wound will get pus. Somehow this is a common belief, but we know, and it has been proved scientifically, that this is wrong. But still people have belief. So whatever we believe, whatever belief we have, it is not necessary that this is part of truth as well. So for knowledge, it has to be truth, number one. And once we drag it into our belief system, so this is the one which we have. But the portion which we justify through scientific methods, that will call be knowledge. So in other words, knowledge is defined as justified true belief. And getting this justification is research. I will slowly repeat this sentence. There is truth in this universe, and we have a belief system. This truth and belief system overlaps on each other. As a result, the portion which is overlaps, that is part of our understanding. But it is not definite that that understanding is true knowledge or not. However, if we use some method so that whatever our understanding is, and we convert it into a scientifically provable fact, then this will be called knowledge. So knowledge is defined as justified true belief, and research is actually a process of justifying it. So that is what is the definition of knowledge, and that is its correlation with research. Fiza, are we on the same page, beta?
Yes, sir.
I cannot
Everything's clear.
actually see I actually cannot see the reaction of the rest of the people. So I can just only address you. So, and if you have any confusion in your mind on behalf of everybody, you perhaps can just stop me and we can carry on. I hope we clearly now we clearly know what knowledge is and what is research about. Okay.
Yes, sir.
So research was born from the womb of a relativist perspective. Even now, if someone by its training, by its genetics, has got a very fixed ideas and has got a dualistic perspective, even in this modern world, we have people who have got very rigid ideas about life. They have got very rigid ideas about knowledge. So for them, research has no value. Research is important only for those which can doubt, which can think and see the things in their relative perspective. I hope it is clear. Now if we see this picture, we can make some meaning out of it, right? And please remember that research is an endless journey. It will never stop. It is quite possible that you spend your whole life in saying something, and then you make another experiment and you say that whatever I have just discovered is wrong. And this may be your end result, that whatever I have done is wrong. But even then, this will be a justified true belief. And that will be a knowledge. It's an endless journey. Now, when I conduct this workshop, some of the people, they ask from me, after all, why? What is the need for research? And what is the reward of that research? Although research attracts a lot of money as well, but for me, the real reward of research is internal satisfaction. You have an awe movement. Suddenly an idea comes in your mind, you prove it, and that feeling of awe is actually a sense of completeness, and that is the reward of research. This is a picture of one of my dear friends, which is Nazir Sabir. He is the person who conquered Mount Everest and K2, and incidentally, he's a good friend of mine. And that is his picture. And he told me that when I was just standing on the ceiling of this earth, the feeling which I had was that even if I die now, the purpose of my life is complete. So when someone is doing a research and actually finds some great idea, he becomes like a person who said, Eureka, Eureka. You remember that famous story? Archimedes, when he found the principle of that why a ship does not sink in a sea, and a needle actually sinks into the sea. So when he found that idea, so he was just in his washroom and he came out nude on the streets of Athens, and he was saying, Eureka, Eureka, I got it, I got it. So that I got it is actually the reward of research, like this. Anyway, sorry for this little long introduction, but this was important so that all of us come on one page. I want to give a few warnings to you before I start. After some time, you may feel like this, or maybe like this. Some of you, I can't see you, so I can't wake you up, right? So you have to make a mechanism so that you remain awake. Maybe just get confused like this, or maybe like this. But I will try my best that I put my 100%. So we know the background. Now, what is research? I will not just text your memory. I will keep on just telling you. Please remember that in this whole workshop, you need not to remember any slide except of 2 slides. And this is one of them. I have designed it in such a way that you will just keep on learning it yourself. But this slide is very important. And even if I ask you to please memorize it or write it somewhere, that will not be a bad idea. Please remember, the keywords are put on blue color. Research is a formal work. Please remember, it's not an informal work. When we talk about research, someone says, I do 5 appendectomies in emergency daily. For the last 15 years, I have done lakhs of appendectomies. So I can just talk about appendectomies. Although he has done the work, but he has not done it formally. Research is not an informal work. It's a formal work undertaken systematically. There has to be a system. There has to be, or which we are going to discuss, in this workshop. It is not random. It is not just a kind of anecdotal ideas. It is not just your own viewpoint about what you are doing. It has to be a systematically done work. And why you do it? To increase the stock of knowledge, which means that already a knowledge exists. There was a time when it was very difficult to locate that stock of knowledge because it was only in the heads and only in the books. And it may be possible that someone wrote a book and it is present in British Museum Library and no one knows it. But now, fortunately, we are living in an era where this stock of knowledge is present in the form of a body of knowledge in certified, kind of a certified stores of the knowledge, which is accessible through internet, right? So if you want to know that what is the guideline for treating a patient who has got stage 4 cancer breast, now this body of knowledge is there. So please remember, research is a formal work, systematically done, and why you want to do it? You actually add something into stock of the knowledge. For example, I remember when I was young resident, whenever we used to do an operation on upper GIT, we used to put nasogastric tube, and we used to keep it for 3 to 4 to 5 days. And this was the standard. And this was the understanding. But later on, when research was done and it was found, and you can conduct the study or anyone can conduct that study. When studies were done, it was found that there is no need. If you empty the stomach after operation, there is no need to put nasogastric tube, because whatever anastomosis you have done, that should be good enough so that the normal secretions can pass through. And you may not put a nasogastric tube. I'm just giving you an example. Now, when this was confirmed through scientific method, this was put into body of knowledge. And now if someone wants to know that what should be the policy of putting a nasogastric tube after upper GI surgery, he can just consult that, and you can. Now maybe someone does another research and this idea may be taken away and then another idea may come. So please remember, there are 3 things we have just sorted out up till now, that research is a formal work systematically done to increase the stock of the knowledge. And why? And the use of this stock of knowledge to devise new applications. That is, since we know that there is no need to put nasogastric tube, so after operation, please don't put a nasogastric tube. That results new guideline. So this is the research. I will say it again. So if anyone out of us wants to do a research, he has to do it formally. He has to follow some kind of a system, and the end result of this research has to be finding a knowledge which will either increment the existing knowledge or will alter or change the existing knowledge. And why for this? In order to have new application. All the new inventions, computers, all new inventions, they are actually new applications. So since we are doctors, so we are focusing on our research on medical things, but the purpose of research is so that we can have a new application. So I would like you to please revise it slowly after me, that research is a formal work undertaken systematically to increase the stock of knowledge and the use of this stock of knowledge to devise new application, right? Now, if you see carefully, it's a formal work systematically done to increase the stock of the knowledge for new application, right? And if we just translate this metaphorical thing into practicality, then we can say that research is a process of systematic data collection, analysis, and interpretation. So basically, whatever I have said before can be translated that when you make a plan and collect the data, then you analyze it and then you interpret it to get a result. And fourth thing is still left in order to find solution of the problem. So this is actually the same thing which I have just described you in the previous slides, like this. It's a formal work systematically done to increase the stock of knowledge, new application, which means it's a process of systematic data collection, analysis, interpretation in order to find solution for the problem. I hope now we have got a clear concept that what research is. Now, please remember, research can be qualitative research and it can be quantitative research. Qualitative research is actually nowadays much more powerful research. Qualitative results actually discuss the phenomena. It discusses the behaviors. It discusses the trends. For example, we want to search that why majority of FSC students want to become a doctor. Now, whatever research we will do for that will be a qualitative research, because it will require personal opinions. It will require personal paradigms, viewpoints. Whereas quantitative research is one in which the parameters which we discuss, they can be quantified, they can be measured, right? So, for example, we want to know what is the incidence of anemia in pregnancy for all the patients who attend the PIMS hospital. Now, in this case, what you're going to study is not human opinion. What you're going to study are actually the digits, the anemia, the age, the gender. So the research which takes into consideration the parameters which can be measured, subtracted, deleted. This type of research is called quantitative research, and those research which are related to social. For example, what was the behavior of the people who migrated from India in 1947? What was the social impact on people who migrated from Pakistan to India? Now, if you want to study this thing, this research will be a qualitative research. What was the factors responsible for the recent strike of YDA in case of problem with the service structure, for example? So if you want to do this type of research, it will be qualitative research. Nowadays, most of the scientific research are quantitative research. But please remember that nowadays there is a mixed concept, because we have realized that when we do a scientific research, this research is again on human beings, and human beings have got feelings. So just without understanding the emotions and feelings, it will not be possible to make a concrete conclusions. So this is why when you will go forward in research, you will know that most of the research are actually mixed method research in which qualitative and quantitative. But however, 90% of research done by medical professionals, they are quantitative research. And from now onward in subsequent slides, we will not be touching qualitative research. We will be touching only the quantitative research. This one only. Okay. Can I have a glass of water, please? Thank you. And I'll wait for you. Sorry. Okay. Jaldi, I'm waiting for you. Okay. Now let's see that how we conduct a research. If you like, you can have a pencil and a copy, and you can keep on jotting it down as well. The first thing when you start, we know the background of research. We know why do we want to research, and we are going to do a quantitative research. Now, before we start a research, first of all, we have to identify our area of interest. Fiza, is it okay?
Yes, sir. It's clear up till now.
It's clear, and we are all understanding it well.
Yes, sir.
Thank you, beta. Okay, so first of all, we have to identify the area of interest. For example, and I would like you to please write down on the paper your area of interest. Maybe someone may write diabetes. Someone may write laparoscopic surgery. Someone may write behavior of medical students in the time of COVID. Maybe someone writes paraplegia. Maybe someone thinks that my area of interest is hypertension, right? So whenever we have to decide about the research, first of all, we have to identify the area of interest. Please do it right now. All the viewers, all the participants, please in your mind think of an area, which is my area of interest. Now, once the area of interest has to be a very broad area, and that is the area where you work or where you have got interest. Once you have done that, the second thing you need is, the area of interest should be selected on the basis of these 5 points. Number one, it should be relevant. For example, when I was conducting this workshop, he's a second year student and he was a brilliant student somehow. He said, I want to discuss the effect of interleukin C on the management of patients with pancreatic cancer. So, and he read it somewhere and he thought he should make research. But the place where he was working, that thing has no relevance. So even if he just finds out something, that may not be applicable. So please remember that whatever your area of interest is, it has to be relative. It should have a relevance with your circumstances. Number two, it should be an innovative idea. For example, if we want to know what is the incidence of fever in patients who have got appendicitis. There is nothing new about it. There is already research available. So reinventing a wheel is just wastage of time and energy. So when you decide an area, it should be something innovative, something which has not been done before. It should be acceptable. Acceptable means that sometime we try to do a research which is affecting the people in an adverse way. For example, in our Department of Medical Education, once we want to do a research about why students they don't come into the classes regularly. In that research, one of the hypotheses was that teachers don't teach well, and this is why students are not coming. And this was actually documented in that this is our hypothesis that actually teachers don't teach well. This is why students are not coming. Now, this research conducted in a teaching institution and has to be implemented through the faculty. When we will just see it through this lens, it will not be accepted. That does not mean that this type of research should not be done, but that the hypothesis has to be phrased in such a way that it is acceptable to the people. I hope I made my point clear. Then it should be cost effective. That research which I mentioned, about interleukin C, that requires measurement of estimation of interleukin C. That was not possible even in one of the sophisticated, labs in the clinical labs in Pakistan. And they said they have to go to Cambridge University for checking, and that will cost around 80,000 rupees per sample. That is not cost effective because you need funding as well. So if you really have a fund, then perfectly fine. Otherwise, your research will not be, you will not be able to complete the research if it is not cost effective. Similarly, it should not have an ethical issue. Sometimes you make a research and that research marginalize the people. It also covers, research in which ethnic groups are discussed, in which human sexual behavior is being discussed, in which poor or rich people are discussed. So whenever this type of things are there, then there are ethical issues about it. So why I'm just describing it in detail is that once you start a research and you send it, this I have borrowed it from College of Physician Surgeons of Pakistan. And when you want to just send this proposal to some body which has to fund that research, or which has to sponsor this research project, or which has to publish this research project, they have got this type of a scoring system, right? Total score is 18. If your relevance is high, you get 3 marks. If your relevance, if your innovation, so you get those marks. And if your marks are less than 60%, then your research is of no use, because it will not be able, you will not be able to publish it, or even if you're able to publish it, this will not be able to produce something which can increase the body of the knowledge. So in the recipe, up till now, what we have learned is that before starting a research, we have to very carefully select the area of interest, and these 5 points must be considered before we decide about the area of interest. Number 2, after area of research, the second thing to do is research objective. Now, for example, you said my area of interest was laparoscopic surgery. Now, what out of laparoscopic surgery? Which aspect of laparoscopic surgery you want to search? Please remember, research objective is derived from a question, which is called research question. Whenever you want to do a research, you don't do it just for the sake of doing it. कि आइए अब research करते हैं, मेरा दिल करता है मैं research करूं. It is not like that. Research means there is something which is bothering you. There is something which is pinching you. There is something you want to know. So if you said my area of interest was diabetes, then your research objective can be why diabetic patients have got more chances of heart attack. Okay, so your research question starts from a question word: why, what, when, how. And this will be called research objective. So please remember that once you have an area of interest, from that area of interest, you identify the missing links. You identify a question, and from that question, you make a research objective. Research objective is actually not the question, but it is derived from the question. In this way, research objective is defined. It is the intent of what researcher wants to do. I want to know that why, after all, heart attack is more common in diabetes patients. Now, this is your research objective. But in order to make it uniform, there are requirements. And requirement is that it should be stated in a clear, measurable terms. And it should be an objective. So for example, to find out, so my objective is to find out the incidence of heart attack in patient with diabetes mellitus. Now this will be called research objective, because to find out what? To find out the incidence. Now incidence is an objective term which is measurable. Out of 100, how many? It is measurable. So whenever we plan a research objective, that research objective should tell us our intent, what we want to do, but in a clear, measurable terms. I hope this is clear. Yes, Fiza?
Yes.
Okay.
So it's clear. Yes, sir.
Okay. You know, I remember an incident that once, you know, there was a winter night, and I went to a village, and it was Ramzan days, and I went to a mosque for Taraweeh, and you know, when I went there, they said okay, there is no one who can recite Quran, so if you have got a beard, so you can just be imam. So I said, okay, you know, I don't remember the Quran, but I knew 30th para and some of the surah. So I started, you know, reciting that in Taraweeh. And after, you know, 4 rakats, when I just said salam, I just looked back and there was no one behind. All of them, they left. So I was just wondering that I'm talking. I hope all of you are there. Fiza?
Yes, sir. We are here.
Okay, तो सारे नमाजी मौजूद है ना, पीछे से चले तो नहीं गए सारे?
नहीं सर,
Okay, so let me give you a few examples. Let me give you a few examples so that we understand that what is research objective. Right? See, like this. To determine the frequency of anemia in pregnancy amongst women visiting the obstetrical outdoor of Services Hospital, Lahore. Now, I said Service Hospital because last time I conducted this workshop in Lahore, right? So now this is one example of learning objective. See, everything is stated very clearly and it is measurable. Frequency is measurable, right? If you use a word which is subjective, then that result objective will not be able to generate the process through which you can collect the data. You can only collect the data if this is stated in objective terminology. I can give you another example. To compare the dressing A with dressing B for the patient with stage 2 diabetic foot. Now, objectively, we know, I hope you know the difference between objective and subjective. Fiza, do you know the difference between objective and subjective?
like objective is the one which we're dealing with. We need to cover that up.
No. Let me say. Objective means that when you say something, it has got same meaning for everybody. And subjective means that it has got different meaning for different people. आप कहें, for example, if you can understand Urdu, I'm not feeling well. No, this is not an objective statement. This is a subjective statement because someone will think that probably I'm having fever. Someone will feel that I'm having vomiting. Some will feel that probably I have got headache. If I say मेरी तबीयत ठीक नहीं है, this is a subjective statement. Whereas objective statement is मुझे बुखार है. Now everyone will understand the same meaning of it. In terms of scientific description, anything which has got same meaning for everybody is an objective statement. And if a statement has got different meaning for different people, that will be called subjective. I hope it is clear now. Now see,
Yes,
when we say to compare dressing A, we know what dressing A is, we will define it. We know what dressing B is, and we know what stage 2 diabetic foot is. So in, for example, 50 patients, we will be using dressing A, in other 50 we will use dressing B, and then we will compare it. And this is measurable. In the first example also, we know what we mean by pregnancy. We know where is Services Hospital. We know the obstetrical department, and we know what anemia is. And then we have to measure it, right? So research objective is one which shows the intent, ख्वाहिश जो वो करना चाह रहा है, of the researcher described in measurable terms. Let me give you one more example. To compare the results of interrupted silk sutures and surgical clips for wound closure after laparotomy for infected pathologies. Whatever is being described, it is described in an objective terminology. Now, if I would have been doing a live workshop, I would have asked all the participants that from your area of interest, please write down a research objective. And then what we do is that we discuss those objectives one by one so that the things are clarified. And my experience is that even if when I conducted this workshop with professors, it is not always clear just by my statement. They have to do it themselves, and only then they understand how to write the research. But we have to just compromise it because this is not possible now. But I would just urge all of the participants that please just don't listen it merely. From the area of interest, please write down an objective. For example, to find out the incidence of heart attack in patients who are diabetics, for example. Okay, so why we need an objective? Now, this is very important to understand because this will just help us understand that why we are conducting this workshop. Number one, it brings the focus. Otherwise, I want to do a research in diabetes mellitus, so you will just start thinking about everything. But when you have just narrowed your question to one point, then that will bring focus to your research. Number two, you avoid unnecessary data collection. For example, you want to know only the data which is related with the heart attack. You need not to do other data collection. Similarly, we will learn shortly what study design is. Our research objective actually defines that what type of study design we have to make, and also it also helps us in making an analysis plan. Now, we have done two things up till now. Area of interest. So let me start it from again. First of all, you choose an area of interest. From the area of interest, you select a research objective, which is your intention, what you want to do. It is in a clear, stateable, objective terms, measurable terms. Now, the third thing you have to do is to find out the operational definitions. Now, what I mean by operational definition, let me go back. What, for example, in this third one, to compare the results of interrupted silk, what do we mean by interrupted silk? Because as I have told you that in research, everything has to be such that everyone understands the same meaning of it. You have an idea of interrupted silk in your mind, but someone else may have a different idea in his mind. So you have to tell them interrupted silk suture means 2-0 size braided silk, surgical clip. What do we mean by surgical clip? And what do we mean by infected pathologies? All the operations which are performed in patients who have got gut perforation, for example. So by operational definition means that you make a complete analysis of your research objective in such a way that everyone understands the same meaning of it. I can give you example of this one. To compare dressing A, what is dressing A? So you will write in operational definition, dressing A, for example, dressing A means a gauze piece which is soaked in liquid paraffin, for example. Dressing B, this is a gauze, this is a pre-formed, pre-medicated gauze on which drug, for example, betadine has been soaked. Now someone understands what actually we mean by dressing A, and then stage 2 diabetic foot. What do you mean by that? You will say stage 2 diabetic foot is according to the guidelines given in textbook of orthopedic page number falan. समझ में आई बात? So actually clarifying all the difficult words, all the difficult. Similarly, you may be just saying that there is nothing to be clarified there in the first example, but here frequency of anemia. So what is anemia? If you are in America, probably 11 mg% is anemia. In Pakistan, most of the population actually has got hemoglobin around 11. So in Pakistan, maybe you have to redefine it and you have to say that anemia means when hemoglobin is around 8, right? So only then this will become an objective statement. So I hope I made it clear that once you know the area of interest, you find out the research objective, and then in research objective, whatever you have to describe, you have to clarify it in such a way that everyone is on the same page and they understand the same meaning of it. If you conduct a research, though that dressing one, and someone in America conducts the research, both of them has got the same understanding of it. I hope it is clear.
Yes, sir, it's clear.
Lovely. Now I'll give you an example, and this example I have not taken from quantitative research, I have taken it from qualitative research. For example, there was a study in which the word planning and perseverance was written. So it says, it means having goals, plans, and the determination to follow through. There was a word overcoming failure, which means having the ability to overcome failure and regard it as a learning experience. So these are some of the examples, which means that whatever you narrate in that research objective, that should have a clear objective understanding, and that has to be documented in your research proposal. Okay? Now,
yes.
Now, okay, let's start from the beginning. Let's start the research. Let's start. I said recipe. So let's start cooking the research. Cooking is a negative word. I mean, so area of interest, first of all, we define. Then from that, we take a research objective. From research objective, we found out the operational definition. And then we go to the body of knowledge. We do a literature search, because whatever you want to know now, it is quite possible that is already known, right? I remember when I wrote my dissertation, this was in 1980, 87, 88. I did my part one in 1987 and the part two FCPS in 1990. So I was writing my dissertation, and the topic which was allotted to me by my supervisor was regional chemotherapy for liver malignancies. At that time, it was not a very popular and not a very, very common topic in Pakistan. So I just wanted something very easy. Should I do a research? So he said, no, you have to do a research on this topic, which is regional chemotherapy for liver malignancies, and we have to do at least 30 operations, and we have to see its results. And at that time, in order to find a literature, there's a big book on liver surgery, which is Blumgart, written by Blumgart. And I found where Blumgart is. He was in Germany. I wrote him a letter. And after 3 months, I received his letter. And he was so kind that he sent me photocopies of all his research. On that actually made my basis of literature search. So research was very difficult when internet was not there. But now this literature search is very easy, and you do it through internet. Now, in this talk, I will give you, please remain attentive. I'll give you a very practical, quick way of how to do literature search. Let me repeat again. You have an area of interest from where you took a research objective, and then you wrote down the operational definition. Now you clearly know what you want to do, and then you go on literature search. Now, literature search you make from journal articles, from research projects, from conferences, these are the areas which are acceptable. They are acceptable, body of knowledge. Now, what you do is, how you do is that I'm sure you are aware of it, that whatever was your learning, research objective, you pick the keywords out of that. Because these keywords will actually help you to find out what has already been searched, right? And then there are so many websites, but this one I always use. If you like, you can take a photograph of it. If you like, I remember it by heart, which is actually PubMed. It's an American thing. It is an international thing. So this is the link. And for most of our clinical works, this is enough. Although there are Medscape, there are other research engines as well. You can search it through Google as well. And there are other very targeted professional, search engines as well. But this is the one which most of the time is sufficient for me. And when you just open it, it will look like this. And here you write down your key object, the keyword. For example, you wanted to do hypertension and diabetes. This was your research question. This was your research question. And you wrote diabetes. See, you get 1, 2, 3, 4, 5, 6. 1,62,306 articles. So what you need is, you need a go down full of paper and a truck to have all those paper, 2,000 printers, and print all those articles. So you have done a literature search. Can you do it? Can you do it, Fiza?
No, sir.
Right. So what will you do? You wanted to know everything which is there about diabetes, and you got it. Now, this is why you find so many keywords. You put another keyword, which is diabetic hypertension. And now you narrow down it to 1,657. But still there are too many. That will need, thousands of papers. You further narrow it down and you say diabetic hypertensive nephropathy, and now you have got 3,010 articles. Still there are too many. But if you can see this end of the screen, you just read this article, see whether it is relevant to you or not, and just tick it if it is. If it is not, go down and go for the next one. So out of 3,000, you select those articles which are really going to benefit you. And then there is a facility there on this page that you can either copy it and paste it on your master file, or you can print it. So depending what is your choice. So what I do is that whenever I start a research, I just write down the all three things, area of interest, blah, blah, blah. And when I come to a literature search, I make a master file. And whatever I get, I keep on pasting it on that master file. So up till now, you have an area of interest, you have got a research objective, and you have got operational operational definitions, and you have got all the literature which is present there in the body of the knowledge on your word master file. And then you have to go through it, and you keep on deleting which is not related to you, and you keep on saving which is relevant to you. In my opinion, for doing one research, it will require on average at least 1 week when you don't do anything else, right? So once you go through all the literature search, it is quite possible that that will give you a strength that good, I have selected a right objective, and it's nice that I'm doing a research. It is quite possible that you may have to go back and revise your research objective, because now you know more about that phenomena and you can now revise it. Or maybe you just cancel the idea. You said, okay, I'll keep the area of interest, this one, but this research objective is actually of no use. And you can go back and find out another research objective. And very rarely it is quite possible that you may even change your area of interest. So this is how you do it. Okay?
Yes, sir.
May I ask anyone out of you, except Fiza, to please kindly tell me what are the steps which you have discussed up till now? What was the first one?
Area of interest.
Very nice.
Research objectives.
Research objectives.
Then we have to make the operational definitions out of them.
Very nice.
And then we have to identify those key terms from the objectives and do the literature search.
Okay. Now this will take, if you are doing only this thing, 8 hours a day minimum, about 1 week. And now it is just like preparing a feast for the guests. You have got all the vegetables cut. You have got your meat washed. You have got your table set. You have got all the masala jat ready to make a research. Okay. So this is why I just said what next, what to do. Now, the second part, before this part, you can always revise and you can change your plan. But once you have come to this part, now you cannot change. It is just like drafting a map for your home. On the paper, you can make a bathroom bigger one or a smaller one, and you can just put your wall on one side, and you can make your living room bigger than your bedroom, etc. But once you have started constructing it, you can't change it. So this is why it is advised that you do spend your maximum time in finding the area of research, then research objective, then operational definitions and literature search. And once you have done that, now what to do next? ये नीचे मैंने क्या लिखा है? Can you read some? Can someone read it?
यानी अब करना क्या है?
यानी अब करना. Okay. In other words, how to conduct the research. The first step is research variables. See, you remember when I defined research, I said it is systematic collection of, it's a systematic data collection and then interpreting, collecting it, analyzing it, and interpreting it. Now, what you going to collect, what you going to interpret, what you are going to analyze, they are called research variables. Variable is defined as that thing in your research objective which can have different values, right? For example, let me go back to our initial example. In this example, anemia, hemoglobin level can have different values. You want to do a study in 1,000 people. Now, patient 1 will have another hemoglobin, patient 2 will have another hemoglobin, patient 3 will have another. So in this example, our variable will be hemoglobin level. And can you pick what is the other variable? Can anyone pick the other variable from here? Fizabaji?
Number of women visiting the hospital.
No, the pregnancy. A woman is pregnant or it is not pregnant, right?
Yes.
So otherwise, rest of it is not a variable thing. Services hospital is not variable. Obstetrical outdoor is not variable. But a hemoglobin level. So in this simple example, in one research protocol, you may have got a research objective in which there may be many variables, and you want to know, like our example with diabetes and heart patient, there may be many variables in that, depending upon what type of research objective we have framed. But in this example, I wanted to make it simple. This hemoglobin will be variable and the other variable will be pregnancy. Now let's see here. What will be the variable? Dressing A and dressing B.
Results. The results.
No, the dressing A and dressing B will be the variable. Okay, and other thing variable will be when we say compare, whatever comparison criteria you will make, that will be variable. For example, we make a comparison criteria hospital stay. That person with the dressing A will stay in hospital for 3 days, and with the B average stayed for 5 days. So that will be the variable. Right? Similarly, in this case, whether we had interrupted silk and then whatever will be the variable criteria. So in order to make the story short, variables are those values which can take different values. In other words, it's a character that can take different values. So once you start doing a research, now you have to start collecting a data. In order to collect a data, you have to make forms or survey forms or questionnaires, and they will be made on the basis of variables. And please remember that so for example, age is a variable, hemoglobin level is a variable. For example, if you want to do a research, what is the impact of having FSC or A level on the academic scores of students in first professional examination? Now this academic score will be a variable. Similarly, hospital stay will be a variable, right? So when you start a research, from the research objective, you try to find out the variables. Please also remember that variables may be dependent variables or it may be independent variables. For example, in case of anemia and pregnancy, which one is a dependent? Which one is dependent?
Anemia.
Anemia is dependent because anemia is because of pregnancy. It is not that pregnancy is because of anemia. It is not anemia which is causing pregnancy, but pregnancy is causing the anemia. I hope you understood that.
Yes, sir.
Okay, so some of them are dependent variables. And please also remember, this is very important slide. If you are doing something else, please stop doing something else. If you are playing with your mobile, our viewers, please turn off your mobiles and just focus on this slide. See, just focus on this area. There is a value which is affecting another value, and finding it out is actually research. It is actually this is research. But once we are doing it, there may be some other factors which are affecting the outcome. Because when we said, for example, in one example, that why is there more incidence of heart attack in patients with diabetes? Now, the simple thing, if we just forget this one and just focus on this one, we will take patients who are diabetic, and after a period of time, we'll see how many of them had heart attack. And for example, out of 100, 7 had heart attack. We say the incidence of heart attack is 7%. But please remember, it is possible that some of them were female, some of them were male. Whether having a different gender has got an effect or not. Secondly, some of them had BMI 30, some have BMI 40, some have a very fat 55. Some of them had associated hypertension, some didn't have. Some of them were malnourished, some were not malnourished. Someone were smoker, some were not smoker. Someone were, village dwellers. Some of them were living in urban areas. So all those things, they must have shown its effect. Now, these cause and effects are called dependent and independent variables, and those which can affect in a hidden indirect way are called confounding variables. And the researcher is a very good researcher, an excellent researcher, if he can identify the confounders. And if those confounders are not taken care of in the research, then the result of the research will not be able to add anything in the body of the knowledge. And now please listen carefully. This is why I asked you to stop doing everything and listen carefully. Just put your 100% focus on my voice. Please remember, confounders are addressed through a process which is called inclusion criteria and exclusion criteria. And that criteria is better if we address it in our research objective in this way, to find out the incidence of heart attack in male diabetic patients. What we have done, we have taken care of one confounder. To find out the incidence of heart attack in male diabetic patients below age 40, having BMI from this range to this range, and who are non-smokers. Now, when you say like this explicitly, you are actually including some of the people. You want to express that what are the values you want to include and what group of the patient you want to exclude. So in other words, just to describe your research intention in the form of research objective is not enough. You have to take care of the confounders. And this is why variables are being sorted out very carefully. Did you enjoy this? Please, yes, sir. Someone should say, ah, ooh, ah, something like that, so that, or maybe clap or something, so that I feel, energized and I feel that I'm doing something good.
Yes, sir. You did. Sir, we have got a few questions here related to this concept.
Okay.
So we have got a question. What if anemia is present before pregnancy?
What?
We are having a lot of background noise from there.
Not addressing our research to find whether that add this word. Please ask someone to turn off the mic. Please, can you mute the mic? I can't. There's a lot of noise. Right. Okay. So if for someone, it is very important whether this patient was anemic before pregnancy or not. So I'm very happy that he raised this question. Now you can rephrase your research objective in such a way, or you can add an inclusion criteria to determine the incidence of anemia in pregnancy in women who had pre-pregnancy hemoglobin of 11. Right? Understood?
Right.
So this is what I'm actually emphasizing. If this, in his opinion or her opinion, this was the confounder. Yes. And when you have a confounder, you have to phrase it in such a way. And when you will write the inclusion criteria, you will say only those patients will be included who possess a pre-pregnancy hemoglobin level. And all those patients who have no document of any evidence of having hemoglobin being checked before pregnancy will not be included. Right. And now this question will be addressed. So you have to be brilliant like this questionnaire, this, person who asked this question, that if something, doubtful comes in your mind, you have to twist your research question in such a way that your query and your worry is being addressed. And many of the time when you send a research and your reviewers actually find out those confounders which you never thought of. And they say, how can you say that this is responsible, whereas this confounder has not been addressed? So whenever you are devising a good research, that research must be, those confounders must be addressed. I hope this point is clear now. So once, okay, let's go back. What was the first thing to do for research? Area of interest. What was
Area of
second?
interest.
Second, please.
Coming up
Research
with a
objective.
research object.
Research objective, then
Operational definition.
then
Literature search.
literature search, and after that literature search, and then what you do?
You conduct the research.
And what's the first thing to
Find
do?
the variables.
You find the variables. Okay, very nice. You find the variables. Now, once you find the variables, now you really know that these things you have to find in your population. Now you know that this type of information you have to collect from the population where you are doing the research. Okay. Now the next thing is now to design the study. Now you have to design the study. Designing the study means that you have to invite your friends for a dinner, and you have decided that dinner will contain continental food. And then, or you thought that no, dinner will have English food, or dinner will have Chinese food. So depending upon which type of population is there, you have to arrange your table and your spoons or knives or straws in a different way. Now, this is what is called study design. Now, you want to get the data, but how you do it, and this is something which is very confusing for the students. So again, I would just try to make it very simple. Please remember, see, now we are at the phase where we have to design our study. We have to design our process of collecting of data. Now, please remember, I will try to make it very simple, and all those confusing names will become very simple for you soon. Please remember that study can be descriptive or can be analytic, right? Now, what I do is in live workshop is that I go out and I come back in the room and just look at the participants for 30 seconds and then say, well, in this conference, in this workshop, there are 20 people, 8 out of them are girls, 12 out of them are gentlemen. Out of 8 girls, 6 are wearing niqab, 2 are not wearing niqab. Out of boys, 11 had beard, others they don't have beard, 2 had a cap on their head. Out of those 8 girls, 4 girls are incidentally wearing red colored dupatta, and there are 2 girls who are wearing jeans, and out of boys, 8 are wearing shalwar kameez, rest are wearing shirt and trouser. Now, what I'm doing is, I'm not doing something from my own. I am just observing and describing. When you do this type of thing in a research, it is called descriptive study design. And how you decide that it should be descriptive or it should be analytic, this will depend upon your research question. Because your research question will actually guide you that what type of study design you have. Now, there are many actually, but there are 3 types of main descriptive study designs. Now, one is case report. I give you an example. A patient came to me, and that patient had a tumor-like growth attached to the uterus. And that was a very funny looking growth. Someone said it is fibroma. I'll not tell you the ultrasound report, although we had an ultrasound report and we made a diagnosis. When we did an operation, we found that that uterus has got an outpocketing. And in that outpocketing, there was pregnancy. And that baby died there. and become mummified. That become mummified, and that is excluded from the uterus, and that remained in that tummy. And the lady got pregnancy again in the remaining uterus and had 3 children, and that thing remained inside. And when we removed it, we found, and she said it for the last 3 years, and we removed it, it was a solidified, observable young baby, small size baby. And I was just surprised. And when we find it out, we knew in literature that this is called fetolith. This is called fetolith. It's called fetolith. It becomes like a stone. And we found that this has been reported in the literature. Now, I thought that I should just describe it. Now, this will be called case report. When you find something unusual, when you find something different, and when you have managed a clinical problem in a different way, that will be called a case report. It is just a description. You have not done any intervention in it, so this will be called a case report. I hope it's clear now.
Yes, sir, it's clear.
I talked, Professor Nahid Fatima is our colleague in gynae. I talked to her. Said, oh, really, you did that? I remember one patient I operated in Multan when I was there, and then there was another patient which we did about 5 years back, and so I have got data of 5 more patients. So I said, oh, really? We just put that data together. Now this will be called case series. Clear?
Yes, sir, clear.
So those are, or most of our research which you see in our literature are actually case series. When someone say, I present a data of 500 laparoscopic right hemicolectomies, which I performed in Qaid-e-Azam Medical College. Now this will be a case series, right? Sometimes thing is not unusual, thing is not very novel, but since the quantity is more, so it is worth presenting, because when quantity is more, then you can make some conclusions, right? So that is also be a case series. So I hope you understood it, that when we say case series, when similar type of patients, similar type of procedures, when they are described together, that will be called case series, right?
Yes, sir.
And the third one is cross-sectional study. This is just like, and the activity which I do is just visualize that there are 20 people sitting in room, and I ask them to do whatever they want to do, and I take a photograph. And if I print that photograph, one person will be just sitting in a gloomy way, another person is laughing, the third one is just rubbing his head, the fourth one is trying to find something in the pocket. So can I say that person A is always gloomy? No, I can't. It was only a snapshot. So when we do a research in such a way that we try to find out something just at one spot, this is called cross-sectional study. Just for one spot. Now, why we do it in this way? Because that sometime our research question demands it. For example, we want to make a hospital which can look after the COVID patients. Now, in order to spend so much money over there, we should know that how many COVID patients are present in our city. Now, what we do is that we just devise a questionnaire, and on one day, we send 30 teams in whole city, and they find out how many COVID patients are there. So for this type of study, where we have to find out the prevalence of a disease or a phenomena, we do cross-sectional type of study. Many of the epidemic studies, many of the pilot studies are those which actually provide us data to devise the larger studies. They are done through cross-sectional studies. So incidence of polio patients in Pakistan, this will be requiring a descriptive cross-sectional study design. It will be prescriptive. I hope it is clear.
Yes, sir. I have a query to address. Sir, many people are asking for a 5 to 10 minutes break for namaz, for Maghrib
Okay,
prayer.
what time is
Can
this?
we?
Yeah. Yes, I'm in Wuzu. I can get the time. 7:30.
Yes, sir.
Okay. Okay, we'll have 5 minutes break. I'll also pray during that time. Okay.
All right.
Acha,
Thank you,
can
sir.
you ask from them how many of them are feeling bored?
All right. You guys can reply on the Q&A
Yeah.
section.
Yeah, they can reply. If you are feeling bored, please let me know.
So
I
there
think,
Okay.
we
sir,
are.
I think, sir,
Yes.
everyone is feeling great. The response has been amazing, and like they are enjoying the session. Nobody is bored by the session. Everyone is
Okay.
having a great
And
response.
how many of us are there who are watching it? Can you do you have any record of it?
Yes, sir, we
Yes.
are having a record of it. Almost we had 1,000 plus attendees, and presently few have left for namaz. So now there are 800 plus attendees right
Okay.
now.
So we have 5 minutes break and then we will meet again. Okay. I'll also pray.
All right. Thank you,
Okay.
sir.
Thank you, sir.
ऐसे लगा रहने दो Okay, let me know when we are ready. Hello. Take a look, okay. मुझे मोबाइल दिला। Hello.
Everybody's back.
Let's confirm before we start. हमें आ रही? नहीं, 32% चाहिए।
Sir, I have a question.
Yes, please.
Sir, kindly elaborate the cross-sectional study. Like, if we are going to compare the two variables, or like we are going to check the frequency, then we will consider it under the cross-sectional study.
Cross-sectional study is conducted when you want to know the situation at one particular time. Then we call it cross-sectional study. What is present at this movement? What is not present in this movement? When you want to find this one, it is called cross-sectional study. And I gave you an example. Incidence of polio patients in Pakistan. Or, for example, no, not in the year, that will be prevalence at one spot. So similarly, you can say prevalence, I mean. Then similarly, you can say what is the percentage of literate people in Pakistan at this moment. So when at one particular spot in time, you want to find out the situation, that is cross-sectional study. Okay?
Okay, sir, thank you.
So let me know when we have to start. Tariq Bashir Chima sir? Oh God, minister?
Sir, we have another question.
Yes, please go ahead.
This question is that what is the difference between search and research?
Okay. We can check it in the dictionary. What are the actual literary meaning of these two words? But what my understanding is that talking in scientific terminology, whatever we are trying to find is it already exists. For example, if someone found out that there is no need to put nasogastric tube after upper GI surgery, this fact was already there. And what I have done it, or someone has done it, has researched it. So if my daughter just had checked it from the dictionary. She's sitting besides me. She said that research is a systematic investigation of already existing truth. Exactly what I was just telling to you. This is called research because you are actually not doing something new. It is already known, and from the and you just kind of unveil it and discover it. So this is why this term research is being used. Okay, I hope it clarified. Clarified.
Yes, thank you. It's understood.
Thank you. Very nice. So let me know when we have to start.
So we can start now, I think.
Okay then. So this is what is called descriptive type of study design. And I have told you that as you will become more experienced, you will just learn that what type of study design you want to use for this type of research. For example, if someone is doing laparoscopic APRs and he has to publish his data, this will be case series, right? So I hope it is clear now. Now we go on to the second category. You remember I gave you an example that I came in the room and I just observed that how many girls are there, how many boys are there, and what are they wearing, and how many have had beard, and how many have had hijab, and how many did not have that. Now this was description. Now if what I do is that I find it out that right side people are talking more than the left side people, and I ask the boys to get up, 3 of them go on this side, and girls come on this side. And I find that suddenly noise just disappears. Now, this is what is a kind of an analysis. That's kind of analysis. In fact, okay, let me say it again. I just went there and I found they are sitting there, and then I noted that the side where predominantly boys are sitting, it is more noisy. And the side where predominantly girls are sitting is more noisy, and the area where boys and girls mixed are sitting, that is quieter. Now this will be observational analysis. It is an analytic study, but it is an observational. Okay, this is an observational analysis. I just observed and make an analysis that this is perhaps because of this, that same gender is sitting together. This is why they're talking more. Now, I hope it is clear. Now, this observational analytic study. So one is descriptive study, other is analytic. And analytic study is further divided into 2. One is observational and other one is experimental. So I'm describing observational first. Now, there are 2 actually examples of observational study. One is called cohort study. Now, when I never knew this word, I always thought that this is kind of a French or a German word, and I never understood it. But when I learned this meaning, and you will shortly learn it, cohort is nothing. Cohort is a population which has similar characters. For example, in our previous example, if we are studying diabetic patients and we want to know that how many of them had heart attack, then this diabetic patients, this study will be a cohort study. It is observing and making an analysis on a population which has got a similar character. That will be called a cohort study, right? So, okay, it's not moving. These we have discussed. This was, okay, forget about it. Now, this is cohort study. Cohort study is just like this. You have got a population, you pass through a time, and then you see that how many got sick, or how many got affected, or how many did not get affected. The example is the same which I gave you, that what is the incidence, what is the incidence of heart disease in patients with diabetes. Now, this study will be called a cohort study. Now, this cohort study can be done in past, and this can be done in future. For example, what we can do is that we can take all the records of patients who were diabetic, and then we go through the record and then see that how many of them had heart attack. Now, when we do like this will be called retrospective study. And if we just take all the diabetes patients, register them, and following them for a period of time, and at the end of the period time, we study that how many of them had heart attack, which will be called prospective study. And you can very easily answer which one is a more stronger study scientifically. What do you think?
Prospective?
Obviously prospective, because in retrospective, there is a chance that that data, since it was not recorded for the purpose of research, so there may be some faulty data. There may be some missing data. There may be certain confounders which were not taken care of and their data is not being collected. But when you do a prospective study, you thought of research. You already have in your mind that this is the factor which you want to study. So you collect the data in such a way that your data is complete. So I hope you understood now that what is cohort study. Cohort is a study design in which you take a group of people with a similar characters and you follow them either in the past, you track them either in the past or you follow them in the future and you just observe the effects on them. Now, this may be interventional as well, which I will describe later. Now, the problem with the cohort study, we have already discussed that it does not take care of the confounders. It does not take care of the confounders. So, case control study is actually a cohort study, but it is designed in such a way that apart from studying that group which had a disease, another similar group is studied which does not have a disease. And then they are compared together. When we compare them together, so it is possible that if someone out of 100, 8 patient had heart attack, and you said that there is 8% incidence of heart attack in patient who has diabetes. Now you have 100 other people who are not diabetic, and when you just followed them, you found that 7 out of them had heart attack. So this was the normal population. And when you see the result of first study, it will tell you there is 8% incidence. But when you actually compare it with the second study in which you had a control group, then the result of the first study just becomes meaningless. It becomes totally meaningless because a person, in order to have a heart attack, may not be diabetic. So when you design it in such a way, let me repeat, what you do is that you have got a group of people with similar things, you study an effect of something on them and calculate the result, and then you have another group which either had the disease but did not have the dependent factor or other way around. Right? You had diabetics, but they did not have a heart attack, or you had heart attack, but they were not having diabetes. And this group is called control group. And when you compare them together, now the results will be more meaningful and authentic because it will be taking care of the confounders. Now, when you design it in such a way, this will be called case control study. It is something like this. Select a population, those who developed a disease and those who did not develop the disease, and then you compare them together. This will be case control study. I hope, since we are short of time, so I would like that even if few things require clarification, we can discuss it at the end. But I hope I have tried my best to make it as understandable as possible. So let me just summarize this segment of it, that one of the study design is analytic. And in analytic, we can have observational studies where actually we don't experiment anything. But whatever is there, we try to interpret it. One of them is cohort, when it's a simple cause and effect study, or it can be case control, in which this is coupled with another study which has got cause but no effect, or effect but no cause. And then you compare them together, and this will make it work. And how it will become meaningful, we will learn at the end of this presentation, which is through P factor, which is called P values, which is the statistical method of making something, understanding something as their significance is concerned. Now, there can be another way. I'll come back to that example. You come in the room, and what you do is that you ask the girls to stand up and go to the other side. And you ask the boys to go on the other side and see what happens now. Now, this is called experimental study, where you actually do something. What was the incidence of anemia in pregnancy was actually an observational cohort study, right? And if you have a control group in which patient had anemia but no pregnancy, it will become case control study, right? But dressing A, dressing B example in our previous objective, that will be an experimental study, where what you do is that you have got two different, for example, what is the efficacy, how, to compare the efficacy of paracetamol and Ponston in patient with tension headache. Now here what you do is, there are some people which will be getting paracetamol, there will be some people which will be getting Ponston, and then you study it. So this type of study will be called experimental study. This will be called an experimental study. Okay, I hope. So this is what study design is. Not very difficult. I just skip this preventive trial and therapeutic trial. You just skip those areas. If you understand what experimental is where the researcher himself do some maneuvering with the cause, either with the cause or with the effect. That is experimental. So in summary, study designs are of two types: descriptive, which are case control, case series and cross-sectional, which are analytic, which may be observational, cohort, and case control, which may be experimental studies where you do some kind of intervention. So that is the study design. I think this is important slide. In the case of experimental study designs, please remember, when we choose to intervene, for example, in our example of paracetamol and Ponston, after all, which we want to study it in 100 patient, one group paracetamol and 100 people are Ponston group. Now, how will we decide that which patient will get paracetamol and which patient will get the Ponston? If we decide it in such a way that we on our own choice, we in our own choice decide, the researcher's choice to decide which one will get paracetamol and which one will get Ponston, then this type of study will be called non-randomized study. And normally that's what happens in most of the studies. If you want to study this, 100 people, to any 100 people you give paracetamol, to any 100 people you give Ponston, and then you compare them. Now this will be non-randomized, and you can very easily understand that this will have less, although this is a scientific study, but it will have less value as compared to randomized. In randomized means I know which patient is getting paracetamol and which patient is getting Ponston, but patient does not know it. We just get a consent form signed from the patient that, look, you are in this study. We have found out that it will not be harmed. You give us the consent. So you pick up the lottery, and if someone gets A, he will be given paracetamol. If B, it will be Ponston. When you design a study in such a way, it is called a single blind randomized trial, because one side of it is blind. But if neither patient knows nor the researchers knows, it is called double blind, because it is quite possible that I may have a relationship with a company which makes for Ponston, which is called conflict of interest. It is also possible that I have got a personal liking for Ponston as compared to Pinkston. So that bias may be included in this research. So in order to overcome that, the authorities, they design double blind trials in which there is someone who is doing research, but he is not in contact with the patient. I am in contact of the patient. I don't know what tablet I am giving to the patient. It is tablet A, but I don't know whether tablet A is paracetamol or Ponston. And patient also does not know whether it is A or B. When you design it in such a way, that is called double blind randomized trial. And you can very well think on your own that which trial is more authentic, non-randomized or randomized?
Randomized.
Which one? Okay, and out of randomized, which one?
Randomized.
Single blind or double blind?
Double blind.
Double
Double
blind.
blind. Double blind.
Very nice. Very nice. So this is how we actually decide about study design. I hope now you have got a very clear concept of study design. Now, let's move forward. Where we had research variables. Remember?
Yes.
And
Yes.
after research variables, you decide the study design.
Study
The
design.
design.
Okay, after study design, now the next thing is to collect the samples. Right? You have got a population to work on. Out of this population, you have to select some people and their results will be journalized on whole population. For example, if you want to know that what is the literacy rate of Pakistan, the only accurate, 100% accurate way of doing this research will be that you write letter to 20 crore people in Pakistan and they all receive the letter and they all fill it and you get it. Now it is 100% sure that you will know the 100% result. Do you think it is possible?
No,
No.
it's
No, it's
not.
not possible. So this is why in research, when you are doing a research on a population, you select the sample size from the whole population. But that sample size selection is on scientific grounds in such a way that the results can be journalized on it. The simple example is that you must have seen a very big utensil called deg जिसमें चावल पकते हैं. You must have seen that.
Yes.
Yes.
Now the person who is cooking that deg, the person who has got cooking that deg, that is his responsibility that all the rice, each and every grain of the rice has to be softened and cooked properly, right? Before he serves it to the guests. Now the best way to be 100% sure that all rice are cooked is that he should eat all the rice. And then he can say with guarantee that each and every grain was properly cooked. But do you think that it is either feasible or it is correct? Because then nothing will be left for the guests.
No, sir,
Now,
definitely not.
So how he decides is that he takes the sample from various places from that deg, and on the basis of that, with a reasonable certainty, he can say कि भाई सारे चावल पके हुए हैं. Now, this is what is called sample selection. And for that, you have to decide how many will be enough. 1 spoon will be enough, 10 spoons will be enough, or 50 spoons will be enough. For that, there is a term called confidence interval. If you increase the sample size, the confidence interval will increase, which will mean that with how much confidence you can say that all rice are ripe. So confidence interval is 100% if you get the data from 100%. If you have got small population, for example, you're doing a study on 50 people or 100 people, you want to know what is the incidence of smoking in a medical class and your population is only first year class, then it is possible that you eat each and every rice. You go to each individual person and you can do it. But if your population is whole medical students of all Pakistan, then it will not be possible to do it. And then you have to take a number of people out of them, but that will decrease the confidence interval. And that confidence interval will be considered accurate if it is up to 95. If after taking देग में से मुख्तलिफ जगह से चावल खा के आप ये कह सकते हैं 95% चांस ये कि पूरी देग पकी हुई होगी, then that sample size will be adequate. So in fact, the next slide tells you how to calculate the sample size. And in order to have 95% confidence interval, that is surety that 95% chances are that my results are accurate. That many number of objects, people must have been examined. तो उसके लिए एक ज़माने there is a long mathematical calculation, but now we have got software available. For example, I use this one, the raw soft com. When you go there, there is already you put the total population. You put the total population, it will give you the number of sample you have to study, but with a confidence interval of 50. So you have to raise it to 95 manually. On it is 50. It is 50, but you have to raise it to 95, and then it will give you the sample size. And this is how you calculate. Can you hold it for a moment, please? A moment, please. Hello, can you hear me now?
Yes, sir, we can hear you.
All right. So I hope I hope all of us are together that once you have studied the design, now how many people has to be questioned? कितने लोगों का data लेना है? This is what is called sample size. And I told you, if our sample size is same as that of whole population, the confidence interval will be 100%. But as we keep on decreasing the number, the confidence interval starts decreasing. However, if it is 95%, it is acceptable and it is considered to be a true representation. And you can do it through this website. Now, once you know the sample size, now there is a big problem. Now, there were 10 spoons were required to be tasted for labeling that whole deg is ripe. But problem is, from where? Should we take those rice from the top, from the surface, or from the bottom, or from the mid, or from the right side, or from the left side? For that, what you need is that is called sampling method. Okay, are we together?
Yes, sir.
Okay, I need around 1 minute pause. In the meantime, I'll just turn off my mic. There's a little work to do. I'll be back in 1 minute. In the meantime, Fiza, maybe you can ask your colleagues to just revise it starting from the top, which was area of interest, and come up to the sampling method, and I will join you in about 30 seconds.
All right, sir.
All right, let's just revise quickly the recipe of research. So the first step is that you have to identify your area of interest. Then you have to make that into a research question, and based on that you have to
Research
derive
objectives.
objectives. After that, you have to define each and every term in your research objective, and that those definitions are called the operational definitions that are relevant to your research. Next, you have to conduct a literature search based on the keywords that are in your research objectives. After that, you come to the main part, that is how are you going to conduct your research, in which first of all you have to identify the variables that are there in your research objectives. And you also have to identify the confounding variables that may affect the cause and effect relationship. And you have to address those confounders, in which you can do two things. That is, you can define inclusion criteria and you can define exclusion criteria, and you can include that into your objectives definitions. Next thing is that you have to see which study design is going to best suit you in order to conduct your research. And then you have to see what kind of sampling technique you have to use and how much sample you have to take. This is what Sir is talking about, and he will continue with that.
Okay, fine, fine. I'm back. Very nice. So I hope that all of you know it. Now we know that how many. Can you mute your mics, please? Now we know that how many rice we require, how many spoons of rice we require. Now the problem is from where we have to require, and this is what is called sampling method. And this is it looks very complicated, but when I will describe it, I hope you will understand it very easily. There are two methods of taking those rice from that date. One is called probability sampling, and other one is non-probability sampling. Non-probability sampling means that probability sampling means that each and every grain of a rice has got a chance to be picked up in that study. You have one spoon, आपने उसमें देग में डाला, हर एक दाने का चांस है कि वो आपके प्लेट चम्मच में आ सकता हो. But in non-probability sampling, the design is in such a way that there are some portion of that deg which can never come in that chammach. Now you can very easily, decipher and can make a conclusion that which sampling method will be more scientifically strong. Which one? Which one, please? Which one will make the study more strong?
So probability sampling will make
Probability sampling.
Exactly. So, but that does not mean that non-probability sampling technique is not scientific. It is scientific, but it is preferable that the sampling technique should be such that each and every member of that population has got an equal chance to be picked up in that. It should be just like when you do a kind of balloting for prize bonds, although one bond will get the maximum, jackpot, but each and every prize bond has a chance to be picked up, right? So you have to select a number of, members of that population to be studied in order to make a conclusion which will be generalized on whole population. But it should be designed in such a way, it is designed in two ways. One is non-probability and other one is probability. I will discuss the non-probability one first. One is called consecutive non-probability sampling, which means you wanted to study the hemorrhoid patients with hemorrhoids. And you selected that if you study 100 patients, then your study will have a confidence interval of 95%. Now, these 100 patients, you started your OPD and 5 patients came, you included it. You had another 5 patients, you include them. Your next 5 patients, you include them. Next 5, till you get 100 patients. Now, this will be called consecutive non-probability. There may be many patients there in population which did not come to you during that period of time. They were not included into it. So that will make it a non-probability sampling. But still, these 100 patients are those from the whole population of hemorrhoid patients. And these are the consecutive patients. The first 100 patients which came, you pick them, and this type of technique will be called consecutive non-probability sampling. The other technique is convenience. See, in our ward, we have got OPD on Monday and we have got OPD on Wednesday. So since our unit is doing a study, so we just picked those patients which came in OPD on Mondays and Tuesdays, because it is convenient for us to do that. So there are many patients who came on Tuesdays and Wednesdays and Saturdays or emergency on Sundays, but they are not included. But we completed our list of 100 by our convenience. So this is called convenience non-probability sampling. And the third way is that since I wanted to complete this list of 100, so I requested all my fellow units that if you have got hammered of patient, please let me know and I will recruit it. So there were 20 patients on OPD of one unit. There were 13 on the other unit, 10 on the other unit, and there were few friends in a nearby hospital. So he told me I have got 3 patients. So I just completed the list of 100, and I completed the list of 100, and this is how I just completed my list, and that is called purposive because I purposely decided in such a way. So all 3 methods will be a non-probability sampling. I hope you understood it. In one case, the first 100 cases. The other one is first 100 cases according to my convenience. And the third one is I purposefully found out those 100 patients so that I can complete my list. So this will be non-probability sampling technique. And all 3 are correct. All 3 are scientific, but you have to mention it in your study that this is how you have done it. And obviously, if you do it with a probability sampling, then the strength of your study will be very strong. Okay. Now, in probability sampling, there are 3 things. One is simple random, which means lottery, simple lottery. And this is possible in patients who has got, when population is very small. For example, you study paracetamol and Ponstan example in 200 patients. So it is easy. Every patient will pick one parchi, and if that parchi has got A, he will get paracetamol. If the parchi has got B, he will get. So this type of, but each and every member of the population has equal chance of getting either paracetamol or Ponstan. So this will be called simple random. Then if population is very big, then it is not possible to do the simple random. For example, the whole population is whole youth of the country, and you want to know the literacy status of whole youth of the country. It is not possible that each one out of it will pick the पर्ची और जिसकी पर्ची आएगी सिर्फ हम उसको स्टडी करेंगे बाकियों को नहीं करेंगे. For that we have this method which is called systematic sampling. This is also like a पर्ची, but this पर्ची is designed in such a way that you divide the whole population into groups. And how you do it? By this formula, which is n/n. The capital N is the whole population and n is the sample size. The population was 640 and you needed 80 people to be studied. What you do is you divide 640 by 80. The answer comes as 8. So what you do is that you divide the whole population into group of 8. And out of this 8, you take a पर्ची. And पर्ची is that every 2nd and 9th patient will be picked. Right? In such a way, you get the 80 people selected. जो ये 80 चावल हैं जो आपने चेक कर देखना है कि देख पकी है कि नहीं पकी. I hope it makes a sense. You have got a huge population and you require a number of samples. You divide that population with number of sample. This will result into division into different groups. Now this group will be now smaller group as compared to the rest of the group. And the way you managed the simple random, you do a simple random in one group and then you replicate it in the other groups. And this is how you decide which 80 people will be selected. I hope it makes a sense. Did it make a sense?
Yes.
Yes.
Okay, lovely. Now, the other thing is that sometimes what happens is, please listen carefully. Sometimes what happens is that the whole population is not similar. For example, you want to study the incidence of malnutrition in children of Islamabad. Children of Islamabad. Okay. And you want to study them into the schools, incidence of malnourishment into school-going children in Islamabad and Rawalpindi area. Now, there is a school called Bloomfield Hall and City School and Roots, and there are certain schools in Saidpur, in Noorpur, and in Tok Sajja, and in Lal Kurti. I'm from Islamabad, so I know all these places. So all these areas. Now, how can you compare that person who is coming to Bloomfield Hall in a school will be compared to municipal corporation school in a remote village near Gujar Khan, right? So in other words, although you want to know the malnourishment in the whole population of that area, of that school going children, but there are stratas there. And these stratas are going to behave differently. If, for example, there are actually, say, 2 lakh students, and your sample size is, say, 5,000, and you selected all those 5,000 from the posh areas of Islamabad, do you think that result can be generalized in whole population? Or if, for example, you select the whole population from the public schools in a village area, do you think you can generalize it? No, you cannot. So in that case, the sampling technique will be faulty. So what you do is you actually decide the percentage of the people in each strata. For example, you think that 30% of these students, they go into posh schools, and 30% they go in a village madrasa, and 40% go into the government schools. So there is a ratio of 40, 30, 30. Now, you have to pick 100, for example, 100 students as a sample. Now, out of these 100, 40 should be from the urban school system, 30 should be from village system, and 40 should be from the madrasa. If you don't do that, then your sampling method will be incorrect. So this type of method is called stratified probability sampling technique. I will repeat it. When we know that whole population is not similar and there are different stratas there, then you actually take the samples, number of the samples from each strata is governed by percentage of that strata out of the whole population. Now, when you do in this way, this is called stratified probability sampling technique. Did it make any sense, please?
Yes, it did.
And the last one is the cluster sampling. Sometimes what happens is that the population is in different places, but they are similar. For example, there are students in Bloomfield Hall, there are students in city school, there are students in Roots School, there are students in some other expensive schools. They are similar, although there are different places, but they are similar. So you think that instead of just dividing them on each school, let's just do it from one school, right? So this is because more or less they will be similar. So in one way, this will take a little probability thing out of the equation, but still the results will be comparable because they are similar. So when population has divisions, but these divisions are not stratified, they are not different from each other, but they are located at different area or they are grouped differently, and you take a sample, that is called cluster probability sampling technique. So if I summarize the whole slide, and this is one of a difficult area to understand, and I'm sure you have understood it well, that now we know कि 100 चम्मच चाहिए, वो 100 चम्मच देख के किस किस हिस्से से लेने हैं, उसके लिए दो तरीके हैं. एक नॉन प्रोबेबिलिटी सैम्पलिंग, which is to take it consecutively or with convenience or with purpose, or if it is probability, it can be sample random sampling, it may be systematic sampling, it may be stratified, or it may be clustered. Can we move forward now?
Yes, sir.
Okay, now अब हमें पता चल गया है कि चम्मच कहाँ से लेने हैं, वो हम डिसाइड कर लेंगे. इतने बंदे यहाँ से लेने, इतने यहाँ से लेने. अब नेक्स्ट हमारा मसला है कि अब हमने डाटा कलेक्टिंग टूल. अब भाई चावल तो लेने हैं, चम्मच से लेने हैं, कड़छे से लेने हैं, हाथ से उठाने हैं, कि स्ट्रॉ से लेने हैं? ये डिपेंड करता है कि वो क्या चीज है. अगर आपने सूप, इफ यू हैव टू टेस्ट अ सूप, then it will not be very nice to try to do it with a fork. And if you want to test tikka, it is better to test it with a fork. So after sample selection, that is the sample size, and also from where to take, we decide the data collecting tool. Data collecting tool is actually chammach, fork, straw, aapka haath or a glass, whatever. How to, what is the instrument actually to collect the data? Well, data collecting tool are actually two: questionnaire and surveys. Now you have all the information in your hand. On the basis of that, you decide to make a questionnaire. What is the difference between questionnaire and survey? Can someone tell me, please?
Questionnaire is, I think, a tool कि जिसमें हम collect करेंगे data.
Or survey?
और survey is जो collected things,
Survey,
the result.
survey is also tool. आप ये करते हैं कि क्वेश्चनेयर के अंदर किसी को घर में भेज देते हैं कि ये फिल करके भेज देना, और यू सेंड एन ईमेल, और यू मेक अ गूगल सर्वे और whatever survey, whatever, you know, that is questionnaire. And survey is when you go yourself and person is sitting in front of you and you fill the form. So which one is more authentic, you think?
Survey.
Obviously. For example, if you want to discuss the emotional behavior of someone and you send a questionnaire and you ask from the person, do you have bad dreams related to sex? What do you think this person will say? He will say, no, I don't have, because there is lot of embarrassment attached to this. I hope you understand that what I'm saying.
Yes, sir.
Or any other embarrassing question, or any other thing which will just label him as a bad person. So it is quite possible that that person will skip all those things. You are studying a phenomena and a person will not give you that data because that. So this is why the authenticity of questionnaire is weaker as compared to survey. In survey, when you go over there, you can actually ensure the confidentiality. You also look at gestures of the patient, and you also have got a time to ensure them various things which questionnaire actually does not do that. Maybe someone did it very hurriedly, but in survey you have a time. So these two are the data collecting tools, and which is designed on the basis of all the previous information we had. At this time, I would just briefly touch, not in detail, the data collecting tool for qualitative research. Now, this research which you are talking is actually quantitative research. But just to give you a little taste of it, the qualitative research is much difficult than the quantitative research. Because in quantitative research, you measure the hemoglobin, easy. You measure whether heart attack happened or not, and there is a criteria for heart attack. But in qualitative research, it is personal feelings. So for that, the data, can you guess what can be the data collecting tool for qualitative research? Can you make a guess? From where you can find out the feeling of a person, or his emotional reaction, or his personal views, his arguments.
Survey.
Question.
Okay, it is interview. The other one is focal group discussions. These are the data collecting tools for qualitative research. So since we don't have much time, so I'll just skip that. Just focal group discussion is that you collect the people. For example, you wanted to know that why doctors went into strike. So you called Secretary Health, you called Vice Chancellor of your university, my dear brother and friend, Dr. Tanveer, and Tanveer Khalik, and you call the YDA president, and you call the patients' attendants, sit them together and just had a discussion with them. And then you record that discussion, and from there you common themes you just extract. That will be focal group discussion. But just I wanted you to know that these two exist. Otherwise, you can just forget about them. Okay, so we had the research variables. we made a study design, then we had a sample selection, then we decided about the data collection tool, whether it will be questionnaire or survey, and what will be the method of doing it, and then carrying out the, obviously, it is you can use it through email, you can personally go there or by mail, that depends upon our circumstance. And you can skip, we can skip that. Okay, now once that data is collected, that data will be in the form of piles of paper. ऐसे ही होगा ना, आपका थैला होगा जिसके अंदर डाटा भरा हुआ होगा, ऐसे ही होगा, या it may be an Excel sheet जिसके ऊपर डाटा डाला हुआ होगा. Like in our one study of that anemia with hemoglobin thing, that pregnancy thing, तो basically एक बड़ा सा 100 बंदों का चार्ट होगा जिसपे लिखा होगा hemoglobin 7, hemoglobin 7.5, hemoglobin 9, hemoglobin 10, hemoglobin 12, आगे लिखा होगा कि इस तरह से लिखा होगा ना. Now this has no meaning. Even if it is in computer, even if it is in the form of a paper, it has no meaning. Now we have to present that data in such a way that it has got a meaning. And that is called preparation of data for analysis. And that depends upon the type of the data. Okay, I will just read it out. Presentation of data so that it is easily understandable. कागजों में जो पढ़ा हो तो समझ में नहीं आएगा आपको. So you have to convert it in some form that when you show it to someone, he will immediately understand it. And it depends upon the data. One of it is called frequency table or chart or graph. For example, the one of the presentation way is called frequency table. अच्छा, मुझे लग रहा है कि थोड़े से ना हम बोर हो रहे हैं, थोड़े से हम बोर हो रहे हैं. So what I would like you to do is just take a pause of 10 seconds. And during that time, take deep breaths. Please, all of 1,000 people who are listening, please take deep breath. Forget about research. Just look at the breath going nicely through your nostrils, into your larynx, then your trachea, then your lungs, and they are going into your lungs. Then bring it out, please, and just keep on observing the air going in, air going out, air going in, air going out. Now just try to expand your imagination and feel that your air is not only going into lungs, it is going to whole periphery of your body. You feel that the air which you inhaled is actually going up to your crown, and it is also going up to your digits, the toes and your fingers. Just feel it. Here I take a deep breath. Deep breath. Air in whole of my body. Here it comes back. And it made me fresh. Okay. Okay, now we can come back to research again. Whenever you are studying for your exams and whenever you are under stress, you can do this simple exercise for about 2-3 minutes, and you will feel that your boredom will go away and you will feel rejuvenile and fresh again. Now, this subsequent discussion, which I'm going to finish in 10-15 minutes, I hope, inshallah, requires a lot of concentration and a lot of oxygen in our central nervous system, right? So please be focused, and thank you for your patient listening. We're going to finish soon. Now, see, when that data is there, we want to convert it into a visual form in such a way that this can be interpreted and then can be statistically analyzed. Now, one of them is called frequency table. The other can be chart, other can be graph. Frequency table means that out of this whole data, which figure came with maximum frequency. For example, we wanted to check the systemic blood pressure of all the patients who come to the OPD. And we found that, 100 patients, 6 patients, they had blood pressure less than 100. 9 had between 100 to 120. 24 had 120 to 140. And 15 had between 151 to 41 to 60. 6 had above 160. So which blood pressure was more frequently seen is this one, 121 to 140, with the frequency of 24. Now, just you had data of thousands of patients, but this chart will immediately tell you that majority of population actually had a blood pressure between 121 to 140. So when you presented data in such a way, this is called frequency chart. Similarly, just don't read what is written on the top, but whatever is happening here, this was almost not there in 1900. Then it started increasing. In 1960, it became maximum, and now it is dropping down. So just by one glance, you can just know this study was started in year 1900, finished in 1990. It's a 90 years data collection. But with one glance, you know, whatever this phenomena was, this was not there in 1900, but in 1960, it was maximum, and now it is again decreasing. It is actually cigarette consumption in people less than 18 years of age. Right? So even if you don't know what we are talking about, just this graph will tell you that the phenomena was behaving in this way. I hope you got the point. Similarly, just forget what is written there. Whatever it is more common in female. 70% of it is in female, 30, whatever it is. Right? Similarly, this is called histogram. The whatever it is more around 40 to 50, and it is also more around 70. But in an early childhood and a latehood, it is not there. Right? So in other words, these 4 or 5 examples I have picked just to let you know that whatever data you have, you actually convert it now in this form so that it visibly makes a meaning. You know, when in initial part, when this computer was not there, all these things had to be done manually, which was a very, very difficult thing. But now it takes more time to explain these 4 slides as compared to make them. Because when you have a data on Excel, you have to click one button and you ask them to make a pie chart, a histogram and frequency chart. It will immediately make a histogram, pie chart and frequency chart. Okay, so this is what is called the presentation of data. After presentation of the data, the next thing is in fact, this is the last thing which we are discussing, and this will actually make us understand what research actually ends. And this requires a lot of concentration. Well, whatever data we have, it is in a presentable form. Now we have to summarize it. When we summarize it in such a way that we want to know that how much data is close to the center and how much data is away from the center. Even if you don't understand my last sentence, you just focus and you will shortly understand. Now, whatever data we had, we calculate its mean. ये बात तो समझ आ रही है ना अब तक?
Yes, sir.
Mean क्या होता है? Mean ये होता है कि you add all the numbers and divide them into the number of the participants. है ना? For example, we want to calculate what is the we are actually studying the pay structure of PIMS hospital, your hospital. And when we calculate the mean, there are 10,000 employees. What we do is that we write down their pay, each one's pay, and we add them and divide it into 10,000. What will come will be the mean pay of the employees of PIMS hospital. Now, please, this answer, for example, comes as 9,000. Do you think it will tell us everything?
No.
But it will give you some idea that the mean pay is 9,000. Now the second is median. And this we do in every research. In every research, we calculate the mean. And we will shortly understand that what is the importance of it. And then we calculate the median. Median is that there was person 1, there was person 10,000. Which one was actually in the center is called median. And for example, the total, we calculate the mean was 9,000, but the thing which come in the center was median was 10,000. It means that there are more people who are getting the pay less than 9,000. This is why around 9,000, because this is the mean. But there are people which have got pay more than 9,000, right? A significant number of people are more than 9,000. This is why it came into median. And mode is the number which is frequently came in that whole data. For example, the frequent one was 11,000. So there are many people who were getting 11,000, but there is a lot of people who were actually less than that. And this is why the mean was less and the median was 10. So in other words, when whatever data we have, we calculate its mean, its median and its mode. If mean, median and mode are very close together, then our data has got a significant meaning. But if our mean, mode and mean are very, very different, in which that means there is actually no correlation. Some people have got a pay of 50 lakh and some people have pay of 5,000 rupees, right? Did you understand that? If mean, median and mode are together close to each other, which will mean that there is a uniform distribution of pay among the staff. So this is just one example, but please you remember that whatever data you get after every research, when you calculate mean, median and mode, it actually tells us the tendency towards center. Okay, and this is the measure of center. Along with that, we also measure the tendency towards periphery. Now you just visualize 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 10,000. Just in front of your eyes, you visualize a scale. On one side there is 1, on the other side there is 10,000. These are the employees of PIMS hospital. And then pay is plotted in the form of bar charts in front of you. Now, first of all, you try to calculate what is mean, what is median, and what is mode, which tells you that how many of them are in the center. Now we are talking something different. How many are close to the periphery? In order to know that, what you calculate is called range. So the mean pay of everyone was 9,000, with the range was 4,000 to 5 lakh. Range is the one which is the minimum pay and the one which was maximum pay. This will be the range. And the other thing you calculate is the variance and standard deviation. Now these 2 points, if you understand, then I will be very happy and I will try my best to make you understand. Now, variance is, see, okay, let me take a deep breath. Visualize that whole bar. There is person on one whose pay is 5,000. There is a person on here whose pay is 10 lakh rupees or 5 lakh rupees. This is the range. Now, person one varies. His pay varies from the mean. Person 2, his pay also varies from the mean. Person 3, his pay also varies from the mean. And when you cross the mean, the person on the other side, his pay is also varying from the mean. Is this point clear? Each member of the population will have a number which will be little different from the mean, except of those which are actually falling on the mean. Is this point clear or not?
Yes, sir, it is.
Okay. Now, if most of the people are close to the mean, which means that variability is less. And if most of the people, their individual digit or number will be varying much more from the mean, that will mean that the variability is more. Is that right?
Yes.
So the quantification of this variability is called variance. So if someone has a variance of 0, it will mean that all 10,000 people have got the same pay. And if the variance will be 1, which means each one has got a different pay from that of the mean. Is this point clear?
Yes, sir.
So range tells us कि कम से कम कितनी थी, ज्यादा से ज्यादा. पे की मैं आपको एग्जांपल दे रहा हूं, अदरवाइज जो भी आपने स्टडी किया है, जो भी उसका डाटा है, उस जैसे अनीमिया का भी जैसे आपने स्टडी किया, जो भी आपने डाटा स्टडी किया, उसमें पूरी पॉपुलेशन में एक वो होगा जिसका सबसे कम नंबर होगा, एक सबसे ज्यादा नंबर होगा. अच्छा, जितनी रेंज कम होगी उतना वो सेंटर की तरफ ज्यादा होगा, जितनी रेंज ज्यादा होगी उतना वो पेरिफेरी की तरफ ज्यादा होगा. अच्छा, जितनी वेरिएबिलिटी कम होगी उतना वो मीन की तरफ ज्यादा होगा, जितनी वेरिएबिलिटी ज्यादा होगी उतना वो पेरिफेरी की तरफ ज्यादा होगा, पूरा का पूरा डाटा. इज दिस पॉइंट क्लियर?
Yes, sir.
And this variance is this quantification of variability. This quantification of variability, if you make it square root, it will become standard deviation. Now, why this is required is with this example. अब गौर से सुनिएगा. तो अब तक मैंने आपको बताया है रेंज ये है कि सबसे कम ज्यादा था और सबसे ज्यादा कम ज्यादा था और ज्यादा कौन सा था. Variance is the quantification of variability in the whole population. So if, and it starts from 0 to 1. If variance, and it is calculated statistically, if variance is 0, that means everyone has got the same number, which is obviously impossible. And if it is 1, it means each one has got the same. It is again impossible. At least there will be one person which will be in the mean. At least there may be many, but at least one. But these are the two extremes. Acha, why we want to know this? Because this variance is required to calculate the standard deviation. And that standard deviation is, just look at carefully these dogs. Can you see these dogs, all of you?
Yes, sir.
Their height is measured from their shoulder. This big one has got this much height, this one has this much height, this one. Now we calculate their mean. इसकी 600 थी, 470, 170, इनको जमा किया 1970 divided by 5, 394. So this green line is 394, which is the mean. Is it clear?
Yes, sir.
Okay. Okay, now this dog is 204 plus from the mean. This dog is 76 plus from the mean. This dog is 224 minus from the mean. This has got 36 plus from the mean, and this has got 94 minus from the mean. And this is the variance. When you, this is, so each one varies from the midline. This, now variance is calculated by this. Iska square, uska square, iska square, iska square, iska square divided by 5 will be the variance. Now iska jo variance होगा वो 21704 है, 21704. मैं भी आपको समझाता हूँ अभी. ये स्लाइड तो समझ में आ गई ना आपको? हमने सारों के सारे जितने वेरिएंस थे उनको कैलकुलेट कर लिया, और इसका जब हमने स्क्वायर रूट किया इस सारे का, तो उसका जवाब आया 147. Now this calculation of 147 is very important. It means कि जो most of the population है वो 147 plus और 147 नीचे के अंदर fall कर रही है. If we know the variance, if variance is very big, which will mean our standard deviation will be big. तो standard deviation 1 का मतलब ये होगा कि जितनी variance थी उतनी plus की side, and the same one on the negative side, right? And we mathematically know that whatever is the population, कितने उसमें से member of the population standard variation के अंदर fall करेंगे. If standard variation is very high, then data has got no correlation because it is more towards periphery. तो जो हम मालूम करना चाह रहे हैं, फर्ज करें हम ये मालूम करना चाह रहे थे कि ब्लड प्रेशर से इंसिडेंस हार्ट का होता है कि नहीं होता, जब हम उसको इस डाटा को प्लॉट करके देखेंगे, अगर ये बात सही नहीं है तो हमारा डाटा का वेरिएंस बहुत ज्यादा होगा और स्टैंडर्ड डेविएशन बहुत ज्यादा होगी, विच मीन्स सारी पॉपुलेशन मिड लाइन से बहुत ज्यादा दूर होगी, डिविएट कर जाएगी बहुत ज्यादा। लिहाजा जो हमने हाइपोथेसिस बनाई थी वो गलत है, ब्लड प्रेशर से हार्ट से नहीं होता। और अगर हमारी वेरिएंस, उसको क्वांटिफाई कैसे करना है, डोंट गेट कंफ्यूज्ड, you will shortly understand what I am saying. So the standard deviation is a measure which describes how much individual measurements differ on average from the mean. ये बात मैंने आपको बता दी है। A large standard deviation shows that there is a wide scatter of measured values around the mean, while small standard deviation shows that the individual values are concentrated around the mean with little variation amongst them. अब ये जो ग्राफ है ना, मैंने आपको कहा था ना कि 2 स्लाइडें सिर्फ याद रखनी है आपने। ये जो ग्राफ है ये हजारों सालों की मैथमेटिकल रिसर्च के बाद बनाया गया है कि जो भी पॉपुलेशन हो, ये अगर उसका मीन है तो 34.1% पॉपुलेशन हमेशा उसके प्लस साइड पर होती है और 34.13% हमेशा उसके नेगेटिव साइड पे होता है। और अगर आप 2 स्टैंडर्ड डेविएशन देख लें तो 13.59 2 डेविएशन के प्लस साइड पर होती है और अगर आप इधर चले जाएं तो 13.59 इधर होती है। I would like some of you, maybe Fiza or someone else, I only know one name, so this is why I'm talking Fiza. By the way, Fiza is the niece of one of my very childhood friend, Muhammad Sharif. And it is actually, whole credit goes to Fiza because he contacted his uncle Sharif and he asked me to conduct this workshop. So, so Fiza is like a daughter to me because he is a daughter to Sharif, who is my school fellow. We were together in Islamabad in our high school. So I only know one name, Fiza. So Fiza, can you just turn on your mobile and calculate that how much it becomes if you add 34.13 with 34.13?
Sir, it's 68.26.
So in any population, whatever is the population, mathematically, the 68 point, how much?
Sir, it's 68.26.
68.26 population will always be within the 1 standard deviation. Okay?
Yes.
Okay. Achha, now you add 13.59 and 13.59 into the 62 point something.
Into this, the previous answer?
All 4 of them, yes, to previous answer.
All right. So sorry, can you repeat?
Okay, 13.59
Yes.
plus 34.13
All right.
plus 34.13 again
Yes, sir.
plus 13.59.
Sir, it's 95.35.
Oh God, did it ring any bell in your head? 95?
Confidence interval?
Oh, confidence interval. So this is why we want to calculate the standard deviation, because 95% of population has to fall within 2 standard deviations. Okay. In other words, the rest of the fringe is actually not very significant, because 95% of population actually falls in 2 standard deviation. So if you know the standard deviation, you can know whether 95, which mean actually 100%, क्योंकि 5% का हमने उसको शक दे दिया था ना confidence interval का, which will mean that if we know the standard deviation and we can calculate that how much people are in that standard deviation, we can know whether most of them are having the same behavior or they are not having the same behavior. This is why it was important to calculate the standard deviation. Because if much of the population will be, very close to the mean, it should be very close to the mean. In other words, if standard deviation is smaller, that means our hypothesis is correct, that hypertension has led to heart failure. And if that is standard deviation is very variable, in which that means 95% of the population is spread far from the mean. Now you must be just wondering that why I put your head into so much trouble by just discussing so much statistics with you. It was just to bring the understanding in your head. As far as the real life is concerned, you need not to do it yourself. You need not to do it yourself. You actually put everything into a software which is called SPSS. SPSS software. You put it into that, and that software on its own calculates the mean, median, mode, range, variance, and standard deviation. And accordingly, it calculates that how much population is outside this 95% zone. And this converts. Okay. I want to ring another bell in your head. See, okay, let me read it out. It gives the estimates of degree to which they will forget about it. So this I told you. Now see, just listen carefully. We are going to finish very soon, so be patient. An important characteristic of a normally distributed variable is that 95% of the measurement have values which are approximately within 2 standard deviation. I told you that. As a result, the maximum confidence interval usually possible is only 95%. In other words, there is always a 5% chance of being wrong. So if our data calculated has got a chance of being wrong less than 5%, that means still this is acceptable. Those of you who are little lagging behind, I just want to remind you that we have got a cause and we want to know whether that cause had got a particular effect or not. If that effect is proved, this can be proved by finding out whether it has got a chance of becoming wrong more than 5% or less than 5%. And whatever statistics I've told you has actually let us know this. This is converted 5. So for correction to be significant, correlation to be significant, the chance of it being wrong should be less than 5%. So whatever statistical method we actually apply tells us only one thing, that this data has got less than or more than chance of being right or wrong more than 5%. In other words, if we consider 100 as 1, then 5 will be what?
0.05.
And this is 0.05 से कुछ घंटी बजी दिमाग में?
Yes, वो alpha या p
Oh,
value.
this is p value.
P value.
This is p value. In other words, whenever you interpret any research, you see whether p value is less than 0.05 or not. And if p value is less than 0.05, that means this cause has got an effect with it. And if that p value is more than 0.5%, that means ये बात सही नहीं है. इसका उसके साथ कोई कोरिलेशन नहीं है, क्योंकि इसका कॉन्फिडेंस इंटरवल 95% है ही नहीं. ये जो चावल मुंह में खाए हैं ना, इसको देख के अंदाजा नहीं हो सकता कि बाकी देख पकी हुई है कि नहीं. Right? So once we have done it, I will just skip all those slides. Once we have done it, what we do is that we make a hypothesis. And the hypothesis is, in fact, these are the last few slides. The hypothesis is that hypertension actually results, the diabetes results into heart attack. ये हमारी hypothesis थी. अब हम उसका confidence interval हमने 95 रखा. जो जितना data हमने calculate किया था, उनको SPSS में डाला, और जो चीज हम calculate करते हैं वो p value करते हैं. और उसके लिए जो टेस्ट अप्लाई किया जाता है वो है टी टेस्ट और जेड टेस्ट। मैं इसकी तफसील में नहीं जाता कि किन केसेस में टी टेस्ट करते हैं, किसमें। मुझे अच्छी तरह याद है जब शुरू में हम रिसर्च करते थे तो मैं पैसे देता था स्टैटिस्टिक्स वाले बंदे को, वो कागजों पे लंबी कैलकुलेट करके then he has to calculate it. Now whether you apply a t test or a z test, it will give you a p value. And if that p value is 0.5%, is more than 0.5%, that means our hypothesis is rejected. That means diabetes mellitus has no correlation with the heart attack. And if our p value is 0.05%, our result will be that yes, diabetes causes hypertension. So we had research variables, we had a sample selection, we had data collecting tools, we carried out the data, we prepared the data in a presentable form, then we did a data analysis. Although I, took a lot of your time in explaining those complicated mathematical things, but so that you understand that what is the basis of it. Excuse me. So you understand that what is the basis of it. But however, nowadays this whole thing is done by the software, and this will actually result into making a conclusion. Now your research is complete. With all this hard work, you found it out. Yes, this is responsible for this, or you said this is not responsible for this. And then you discuss it. Discuss it means similar research which has been done all over, you just discuss it. And you just write that discussion. And then you write the references. All those things from where you got it, जो आपने शुरू में किया था research, वो सारे reference लिखते हैं. अच्छा, इसके बाद अब आपकी research मुकम्मल हो गई, एक चीज रह गई बस. What do you think वो क्या रह गया? खाना पक गया है, देख तैयार हो गई, खाना जबरदस्त.
इसको प्रेजेंट करना और इसको
Publication of that research.
बेटा हमने एक नई चीज दरियाफ्त कर दी है. Now we have to put it into a body of knowledge.
Yes.
You have found it out कि नेज़ोगैस्ट्रिक ट्यूब डालने की कोई जरूरत नहीं है. बट हाउ दुनिया को कैसे पता चलेगा? जंगल में मोर नाचा किसने देखा? जंगल में मोर नाचा किसने देखा? तो अब नाउ द नेक्स्ट थिंग इज, ये देखो मैंने एक फिक्रा लिखा है. कैन समवन रीड इट प्लीज लाउडली?
It is not enough to love someone alone. You have to tell him or her too.
Right. So that is what up till now you have developed a feeling, but now you have to express it. And that express it means writing it up. Now writing up requires another workshop. How to write it out. And it is much easier than this workshop. Now once you have done a research, then you do a write up. Now this write up you will send to a filter. That filter is a research journal. That research journal will pass through that research journal like a filter. They will verify that whatever you have done has been scientifically done correctly. And if they publish it, it will automatically go to body of the knowledge. Now everyone will know that this thing has been, researched and told by Fiza Shafi. And anyone in the coming time will try to find it out, he will find it out. So this is the complete story. And I will ask your organizers that you can arrange a workshop on write up later on. But actually write up is not as difficult as actually conduction of research is. So I'm going to finish, but I would like to give you homework. Otherwise, this all hard work of myself and yours, it has been how many hours now? Oh God.
3 hours and 29 minutes.
God, we thought we'll finish it in 1.5 hours. So this 3 hours, thank you very much for being patient. That will all be wasted if we just listen it and clap it and just go home. I would request you to please prepare a research proposal. This is very, very important. You follow that all recipe, select the area of research, select the research objective, then all those variables, blah, 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 and come up with a proposal. May it be a very simple thing, and then you start doing a research. In the end, I would like to say that word can only be changed if we have a research attitude. And please trust that we can. We can. Please research that we can change the world. Thank you very much.
Thanks a lot, sir. Thank you so much for sparing some time. I think we have spent so much time on this, such an important thing.
Yes.
So, any question and answers would be addressed, and then we'll share them afterwards. I think, if sir, you could answer it right now or afterwards, I think would be fine.
I think I have tried my best that all those things were self-explanatory. However, if you have any questions, you can just give it to Fiza and maybe we can address later on, because I have got a little more commitments as well. And I have tried to, whatever queries actually could be generated. Since I have just conducted these this workshop for a beginners, many times. So I know all the possible questions which can come, but still there may be many questions. And I have skipped some of the slides because this is actually a 3 days workshop. So, so if you have any questions, you can give it to Fiza and Fiza can email me and then we can address that.
Yes, so we'll share the answers with you all, with all the attendants. Now, I would like to give over the mic to Aisha Naeem from 4th year to just finish off with this session.
Thank you very much. So this brings us to the end of this session. The aim of conducting this session was to give the audience a big picture for the research process, where respected Professor Javed Iqbal touched each step of the research methodology, and in a very good manner, he primed us for the subsequent sessions. We really thank our audience too for your participation and your patience, and hope that today's session was helpful for you guys. Since we have already exceeded the time limit, in order to learn the best, your question answers have been noted and shall be answered and shared in the form of PDF files in your respective WhatsApp groups. In the end, I thank Professor Javed Iqbal again for your time and your effort, for actually giving us much more time than was negotiated. We also thank Department of Community Medicine, Federal Medical and Dental College for their constant support for this workshop, and Federalite Students Research Society for conducting this.
When you finish, I would just say one sentence. You just please finish it and then give me 1 minute, please.
All right. I just want to thank our audience once again for their patience and participation, and I just hope to see you guys tomorrow, inshallah, again at 6 with our next session. Over to you, sir.
Okay. Yeah. Thank you very much for all your patient listening. See this. I have just retired from my government job, but I'm working on different projects, which are actually teaching undergraduates and postgraduates, and especially the faculty regarding medical education. So now the time is so short and the projects are so many that it is difficult to really channelize them in such a way that they can be organized. So I have just started a channel, YouTube channel, and you can access that channel by writing Professor Dr. Javed Iqbal. And that channel, actually, obviously it's free. And that channel, I put a lot of my work, which is related to health awareness, which is related to research, which is related to FCPS training, which is related to career counseling for medical education, medical students, and also the young doctors, and also related to leadership and social things. So if you are interested, I'll be very happy if you subscribe that channel and get benefit of all those things which are there. So thank you very much. Thank you for having me. I had a wonderful time. Thank you very much.
Thank you, sir. At the end, I would also like to thank our community medicine department, that's Dr. Junaida Sarfaraz, Dr. Rabia Mahmood, Dr. Nadia Junaid, and Dr. Gul Meher for this support in organizing this workshop. Thank you so much. Thank you, sir. Thanks a lot.
Thank you. Goodbye.
Take care. Allah Hafiz.